Otoplasty is aesthetic correction of the ears. Oftentimes what the problem is the ears just stick out too far this way. What the major objective in otoplasty is pinning back the ears. Now there are two major types of deformities when we talk about a need for otoplasty. One of which is called a lop-ear deformity and the other is a cup ear deformity. A lop-ear deformity occurs when the upper portion of the ear, this cartilage, there's a little ridge called the antihelix. When that is absent, the ear flops forward, and that is known as a lop-ear deformity. The other type of deformity is a cup ear deformity. A cup ear deformity refers to a condition in which this part of the ear that's inside, called the concha, is overdeveloped and the ear actually protrudes out. Now, oftentimes, both of these conditions can exist or commingle in the same person. Strategies to reduce the ear are different based on what the problem is. If you have a lop-ear deformity, what you need to do to correct that condition is actually to bring the cartilage back so that you recreate this antihelical fold. I'm going to talk a little bit about how to do that. Essentially, the way you do an otoplasty, or at least the way that I perform an otoplasty, is that an incision is performed on the back side of the ear where a little bit of skin is removed, but the incision is well camouflaged in the back of the ear. Then what happens is I soften the cartilage. I soften the cartilage just by scoring it without going all the way through. The reason that's so important, in my opinion, is that if you cut all the way through the cartilage, over time, that little band and little ridge can show up. So I really prefer not to do so. But by scoring it in different directions and softening the cartilage, that cartilage really will stay in the right position, for forever. The second thing after that is then to position the ear appropriately with little sutures so that they stay in the right position. And I do that so that both sides look very symmetrical. Then you close the skin. So it's a very simple, straightforward procedure done in about an hour to hour and a half under a little bit of IV sedation or twilight anesthesia. I don't prefer to use straight local anesthesia because it is uncomfortable, but general anesthesia, unless you're a child, is not necessary. A cup ear deformity, as we just mentioned, is a condition in which the conchal bowl of the ear pushes the ear forward. That oftentimes is less common than a lop-ear deformity. To correct the cup ear, what you need to do is to take the cartilage portion here and pin it back so that that area that's over protruded does not flare out as much. At times I will reduce the cartilage here. It is an area, in my opinion, that's much more forgiving in terms of actually cutting a little cartilage out, whereas out here, when we're doing a lop-ear deformity, I don't believe cutting that cartilage is a very safe maneuver to be made. Let me talk to you about the recovery time so you understand what to expect afterwards. You will have tiny little drains that I will remove on the first day after the procedure. You don't feel that at all, it just slips right out. And you'll have a large dressing for one night. The next day I take down the dressing, and oftentimes the ears look a little bit congested, but they really oftentimes don't look so bad even at a day. The swelling is primarily down within 2 or 3 days and even less than a week. However, during that week I have you wear a headband 24 hours a day, even during the day, sort of an athletic headband that you can just purchase at your local sporting goods store. At times, if I look at your ears at day 1 and I see that they're a little bit congested, I may put back that large dressing for another 1 or 2 days, but that's relatively uncommon. Afterwards, I suggest or actually recommend that you continue to wear that athletic headband at night for about 6 weeks or so. The main thing to understand with this recovery time is that you really don't have much of a recovery with ear pinning back. If there's a little bruising or congestion, that could last a week or a little bit over a week. But if there isn't much bruising or swelling, then oftentimes, even within a few days, the ears already look better. Remember, part of the reason why is that even though there may be a little swelling, we've already positioned them further back, so they already appear smaller at that point.